While defunding cost-sharing reductions certainly impacts lower-income Americans, it also impacts American Indians. I'm Bryn McBride of ABC for Health. We're talking about some of the unknown consequences, or maybe little-known consequences, of the Trump administration's October 12th decision to defund cost-sharing reductions. Now, these are the payments that are made from the federal government to insurance companies to bring down the cost of things like deductibles, co-pays, and co-insurance for individuals that have marketplace plans. Now, these are for folks that are between 100% and 250% of the federal poverty level, typically. So for a family of four making about $60,000 a year, if they had a silver plan, they would be eligible for cost-sharing reductions. The payments that are made from the feds to the insurance companies get passed on to the consumers in the form of cost sharing, hence the name cost-sharing reductions. Now, if you're an American Indian, you are eligible for what is considered to be an enhanced cost-sharing reduction or a comprehensive cost-sharing reduction. If you are American Indian or Alaskan Native, you buy a marketplace plan and your income is between 100% and 300% of the federal poverty level, you can enroll in a zero cost-sharing plan. That means no out-of-pocket costs for you at all. Now, no matter what your income is as an American Indian, if you have a marketplace plan and you go to Indian Health Services for your care, you will also see no cost sharing of any kind, zero out-of-pocket cost. Now, because cost-sharing reduction funding is compromised because of the Trump administration, the impact will be felt by lower-income Americans and American Indians. Now, why was it in the first place that enhanced cost-sharing reductions were even offered to American Indians and Alaskan Natives? Well, for a couple reasons. First, it was in recognition of the federal trust responsibility to provide for the health of American Indians and Alaskan Natives. So we're talking about a lot of legislation and treaties over the years that has been designed to ensure health for American Indians and Alaskan Natives. It was also designed to encourage tribal enrollment. So for tribal members to enroll in the marketplace. It was also designed to reduce the strain on Indian Health Services. They get enhanced reimbursement for their members that have enrolled in a marketplace plan, as well as some of the benefits of these no-cost of out-of-pocket cost plans. Now, what are we talking about in numbers here? Well, for comprehensive CSRs, the Centers for Medicare and Medicaid Services estimated in the middle of 2016, we're talking about 26,000 American Indians across 38 states that took advantage of this enhanced cost-sharing reduction. Getting rid of that, the impact, not yet fully known. We have been following some of the information that's been put on the National Indian Health Board's website over the last several days. They have commented that they see the proposal, the compromise proposal, offered by Senators Murray and Alexander out of the Senate Help Committee as promising, but they do acknowledge the future is very unclear, and they are concerned for their members. If you want to join the conversation and keep your finger on the pulse, you can share your healthcare story with us, send us an email, or ask a question. And you can do all of that on our website at healthwatchwisconsin.org. Thanks for joining us.